Welcome to the module Pain Communication for CNAs and Other Non-Nursing Staff. This is Module 6 in a series about pain assessment in nursing homes. The objectives for this session are to talk about the importance of communicating information about pain, to talk about challenges to effective communication about pain and ways that you can overcome these challenges, and to describe what and how information needs to be shared between CNAs, non-nursing team members, and nursing staff. Well, what is pain communication? This is really any information that's shared between healthcare providers about pain or possible pain-related behaviors of nursing home residents. And it can include a variety of different mechanisms. It can be written reports, it can be verbal sharing of information, hallway chats, it can occur in team meetings, it can occur by telephone or by email, a number of different ways that information can be communicated. Well, who tells who about pain? Well, there's different communication pathways. One is from the resident directly to the CNAs that care for them, to nursing themselves or non-nursing team members. It can also occur between the CNA and the nurse, or non-nursing team members and the nurse, and between the nurse and the prescriber. So pain communication occurs between a lot of different people, but is very important. What are some challenges to pain communication? Well, you're clearly thinking about time, the time that it takes to share information, especially when there's a need for multitasking and doing all the other responsibilities of your job. It may be that it's difficult to locate the person that you need to communicate information to. Sometimes it's not clear about what information needs to be shared and which provider the information needs to be shared with. And sometimes we have limited information about the resident, their status related to dementia, or if they're a new resident, we may not know a lot about that person to know what is important to share. The format for sharing information can also be a challenge, whether information is shared face-to-face or in written reports. And how should information be documented? Where is it documented? Who has access to the information? And when should documentation occur? We're going to talk about these challenges and strategies to address them. Related to limited time, this can be addressed by making sure that pain reporting is a priority and that there's a formal mechanism for reporting, and pain charting tools can help simplify that process and the time that's required. So what is the format for sharing information? Documentation. There needs to be clear pathways for documenting information about pain, and this needs to be institutionalized in your nursing home. Formal documentation can improve communication between providers about the resident and their pain problems. It can make sure that important information isn't lost in side conversations. Documenting pain information is important to establish the treatment plan that's needed for the resident and to be able to evaluate changes in pain as treatment is implemented. One key rule is to always ask questions. Make sure you understand what you need to do and what you're being asked to do in relation to pain and its communication. What information needs to be shared? This is specifically for CNAs or other non-nursing staff. What do you need to tell the nurse? Well, it's important to share any concerns that you may have about your resident. Did the resident tell you that they're having pain? Did you see behavior that made you think something's not right with my resident that I'm caring for today? You need to communicate what you know, what you saw, what you heard, what you think about the possibility that this resident with dementia might be experiencing pain. It's also important to share when you received the information. Did you observe information or learn about pain-related problems during morning activities of daily living? Did the resident report pain at bedtime? The timing during the day can be very helpful. And finally, other additional information that you've gathered. Have other staff members noted the same behaviors that you have that you think are pain-related? Have you observed something like a red area on a resident's skin during bath time that you think might be related to pain? These are all important communications that need to be shared with the nurse so that she can follow up and do a more comprehensive assessment. How is information shared? Your nursing home should have a policy about communicating pain information and procedure that describes what you need to do. For example, a pain communication policy might describe that pain documentation is the way in which evidence-based pain practice is maintained and relevant information is shared. A procedure is more specific and may document exactly the steps that should happen within your facility. Here's a couple of examples. An initial pain assessment will be documented at admission for all residents, or all staff will document pain information on the nursing home pain assessment form. These are just examples of procedures that can help guide what happens in your nursing home related to pain communication. Documentation and the importance of it can't be understated. It paints a full picture of what's happening with the resident. It keeps all staff informed about what the issues or concerns are related to pain. It establishes the resident's baseline level of pain, especially on admission, or if the resident hasn't had pain, that's the baseline that's important to monitor over time. And documentation does allow for tracking to observe when there's changes in behaviors or reports that are of concern. Documenting makes your job easier because you're recording things and don't have to remember. It's part of the legal record that's important for each resident's documentation of their assessment and treatment plan. And documentation impacts our residents by supporting improved health and quality of life. So to summarize, what to document: all related information, what the resident tells you, what you observe, and who you shared the information with. When to document? It depends on the situation. Immediately is ideal, but it's understandable that sometimes documentation has to wait till the end of the shift, but it always must be documented the same day. And where to document? Your nursing home needs to establish the procedure, but in the medical record somewhere. It may be on a pain screening tool or a pain communication form. Depends on what your nursing home establishes as the best place for you to record information. So takeaway messages for this segment on pain communication are to reinforce that pain communication is a very important part of a quality pain assessment. It's important for all staff to understand what needs to be communicated and how it should be documented. Each of you has an important part to play in communicating about residents' pain. You can be a pain champion by playing your part in communicating about your residents' pain. And our ultimate goal is always to communicate information about pain to improve the quality of life for all the residents you serve.